So let's view this. The three-dimensional stereolithographic models and how the changes occurs in the alignment and movement of the teeth. Can you appreciate the movement one by one? And this is how you align the teeth. Once the teeth is aligned and the setup is ready, it is sent to the doctors for the approval. Once we receive the approval, it is sent into the laboratory procedures for epoxy model pouring. Then in the thermoforming machine, where the sets and trays of the aligners are being fabricated. This is a thermoformer, a machine where the aligners are being fabricated. Here the models are being placed. Here you load the sheets and the heat is applied from this machine. Since it is a thermoplastic material, it makes the sheet softer and then finally adapts onto the surface of the teeth on the models. Now, what are the clear path systems? First of all, the records, they are being submitted to our office. Once we receive the records, we make this digital diagnostic setup and we send to the doctors for the approval. If the doctor wants certain changes in the setup, they send us back for the modifications. Once we are done with the modifications, we send it again to the doctors and they approve them. Once that's okay, that goes into the manufacturing process and finally the aligners are manufactured and shipped to the doctors. Okay, let's have a look at this video clip. Okay, so let's move forward. Okay, we are also registered with the MHRA UK. Clearpath Orthodontics is the only FDA approved worldwide company in Pakistan. Okay, the Clearpath is only approved manufacturing, clear aligners manufacturing company in the Pakistan. Then we are also registered with this Clear Path Orthocare Australia. We are registered with this Clear Path Orthocare New Zealand. This is the most favorite book of the post-graduation in orthodontics. That's the Orthodontics Current Principles and Techniques by Greber. And here also we are in the emerging list of the currently available aligners. Okay, let's move on. Now, overview of an aligner and the biomechanics, that is how it actually works. Now, we all know that these orthodontic appliances are basically given in order to improve the overall appearance and aesthetics of the patient and to treat the malocclusion. We all know that on a widely basis, these appliances are classified into the removable and fixed. Now, the removable appliances are those which can be easily removed by the patient, whereas the fixed appliances are those which are fixed onto the surfaces of the teeth and they cannot be removed. Aligners is a type of removable appliances which can be easily removed and inserted back by the patients. Now, what is an aligner? Actually, aligner is the appliance similar as the tray used for bleaching and teeth whitening procedures. It is a custom-made appliance that is thermoplastic in nature and should fit snugly onto the patient's teeth. Now, how it works or what is actually biomechanics? It works on the property of resiliency. You know resiliency? That's the ability of the material to go back to its original position. Like in fixed orthodontics, we have night-eye arch wires. Night-eye arch wires are inserted into the metal-like teeth. They move back into the original position, taking the teeth and aligning them. On the same property, these aligners work. Let us appreciate this. Suppose these are the teeth to be corrected. This is a tooth to be corrected. It is transferred into CAD/CAM model. Aligners fabricated, inserted onto the patient's teeth, and see how it corrects the tooth. So this is how the tooth is corrected and the alignment is being achieved before and after. Now, do you think the fabrication of these aligners is as simple as 2 plus 2 is equals to 4? No. It requires a lot of skill, experience and technology at every step so that we can make the precise of movements in each step. Do you think that a single aligner can correct the malocclusion? No, but a series of aligners can. Okay. So how it actually works? You basically incorporate these tooth movements into each series or each tray or sets of the aligners. Like you can appreciate this in the figure. So this is how step by step the correction is being achieved. Next is the case selection parameters and limitation with the aligners. Okay, now what are the cases you can select and what are the limitations? So what are the indications first? You have to make the right choice of the cases to be selected. First of all, aligners are widely used to treat the crowding of approx 4 to 6 millimeters per arch. They are used to treat the spacing of 4 to 6 millimeters per arch. They are indicated for the deep bite cases to bring out the absolute inclusion of the upper and lower anterior teeth. Similarly, they are also used to treat the open bite cases by the absolute extrusion, which can be achieved by using the attachments. They are used for the cases of single lower incisor extraction, where we have crowding in the lower arch and we extract a single lower incisor. So in these cases also the aligners can handle them well. Then they are used for the closure of premolar extraction spaces. Previously it was believed that aligners cannot be used in the extraction cases, but now with the latest advancements and innovations, they are also used to close these extraction cases with the use of EBT and attachments. EBT is elastic button technique. They are also used for the discalization of molars by dipping movements. They are also used to bring out the translation of the molars again using the attachments and EBT. They are used for the constructed or narrow arches by bringing about the extension in the posterior regions, and they're also used most commonly after the relapse with the fixed orthodontic appliance treatment. The cases where we found the relapse, we can treat them very easily with the aligners. Let's move on. Now, what type of movements can be done? In the anterior region, we can do a translation up to 4 millimeters, while in the posterior region, it can be achieved by up to 2 millimeters. Then the rotation, up to 20 degrees of the rotation that can be corrected with aligners. Absolute intrusion can be done up to 2 millimeters, while the absolute extrusion is done again with up to 2 millimeters with PDA. Now you have to concept what is absolute extrusion and what is relative extrusion. Anyone please? What is absolute extrusion and what is relative extrusion? Any idea? Okay, we will be discussing in the upcoming slides. See, this pure extrusion is actually the absolute extrusion. Suppose we have an open bite case and we are treating by the extrusion of these interiors. That's the pure extrusion or the absolute extrusion. Relative extrusion is what? When you have proclined upper anterior teeth and you retract them, so they also give you an impression of extrusion. So that is the relative extrusion. Let's make it more clear with this animation. See, this is absolute extrusion. Can you appreciate? Absolute extrusion. And what is relative extrusion? These are the proclined upper anterior teeth and you are retracting them. So they will give you also an expression of extrusion like this. So this is relative extrusion. I think now this is clear. Okay. Now, what are the limitations with the aligners? We also have some limitations, right? They cannot be used in the partially erupted teeth or the short clinical crowns because they do not have the sufficient surface area. Then, they cannot be used in the severe skeletal discrepancy like the skeletal open bite cases. They cannot be used in the high canines or the cases with the blocked out teeth. For this you need fixed appliance treatment. First you have to go for the extraction and then you have to extrude this canine into the arch. And last, they are difficult to treat with the multiple missing teeth. Oh, let's move on. Any questions up till now? Yes sir.
असेस कर सकते हैं कि ये केस जो है ये पास कराने से हो सकता है या नहीं हो सकता, या हमें इसके लिए आपको भी मॉडल जो आपने इसके बताई हैं वो आपको भी बनानी होगी, आप हमें बताएंगे कि ये केस जो है ये हमारे अलाइनमेंट में ठीक नहीं हो सकता।
Thank you so much sir for your question. It's really helpful. Okay, and sir is asking how can a general doctor or general dentist can know this case can be treated with the aligners and this case cannot be treated with the aligners. Okay? First of all, I mentioned all the indications. Okay, what are the basic indications for the aligners? If it's already present here, obviously you can treat the case with the aligners. Secondly, you also have an option. You can consult our team, you can consult us. You can send us the pictures and records and we can guide you. You can ask us that whether this case is treatable or doable with the aligners or not. And we can evaluate it and we can guide you in return if you are facing any sort of difficulty whether it can be treated with the aligners or not. I think it makes sense now. Any other queries?
इस तरह आपने दिखाया रिट्रैक्शन कर रहे हैं, 2 फेज पे रिट्रैक्शन मोस्टली हम करते हैं केनाइन को रिट्रैक्ट करने के लिए। तो इसमें आप इसका पाथ कैसे क्लियर करते हैं? मतलब आप उसको रिट्रैक्ट कर रहे हैं तो स्टेप उसको पीछे पीछे थोड़ा थोड़ा किया जाता है कि आगे से फ्री छोड़ा जाता है मूवमेंट के लिए।
Actually, we are not correcting it with a single aligner. As I mentioned, we have different steps of aligner with different trays of aligners. Suppose 20 stages of aligners are required for a treatment to be completed. Means, usme 20 trays will be given to you. They will each will be having a numbering system. 1, 2, 3 till the 20. And stage exactly as it is. And one by one you have to insert into the patient's mouth. So they will bring the movement in stepwise manner. We cannot bring the entire movement in just one stage. No, we are bringing out very light movements. Okay, we are not applying heavy forces. We are applying only light and continuous forces exactly done with the braces.
I have experience of 2 cases with mobility. That's the problem I face.
from where you manufactured those aligners. So you should contact us back now.
We have contacted, we have removed everything. And this is the problem that we have not contacted again.
There must be some other factors responsible for them. Maybe the hygiene of the patient was not good. Maybe the periodontal conditions of the patients was not good and they were not appropriate. Or maybe slight mobility was already present at the start of the treatment. So we have to rule out all these factors.
Do you have seen this kind of problem with other dentists or
No,
most of them don't?
Alhamdulillah. And Imran Sharif sir can let us know कि कितने हम पाकिस्तानी डॉक्टर्स currently treat कर रहे हैं.
Running doctors are at least 7 to 800 doctors.
Around 7 to 800 doctors we are treating, running doctors. And Alhamdulillah they contented and satisfied. If you face any such a problem, you can email us and the CLEPA team is ready to help you.
The entire sequence of sliders is set one time, patient response के मुताबिक teaching sending that models of it उसके बाद fresh बन के आता है ये बता.
Thank you so much, Dr. Aisha, for your question. In this also we have two options. One is the request from the dentist. If the dentist himself or herself requests you want all the sets of the aligners once in a box, we supply them. Or if they don't say that, then we supply the set of 5 aligners at one step. 5 steps, the patients so then he monitors the movement of the teeth, he satisfied, then he ordered another 5, and that way we proceed. Okay? Now let's move forward. Now the case record submissions and the clinical cases. Now, what are the different case records which are required from the dentist or orthodontist at our CLEPA? Okay? These are the different records. Of course, we require the upper and lower impressions with the PVS, that is the polyvinyl silicone or putty impressions. Then we require the bite registrations. We need the 2 radiographs, that's the OPG panoramic and the lateral set. We need the intraoral and extraoral pictures. And last, we need the CLEPA diagnostic and treatment form, which will be supplied by a regional team, so that you can fill out all the details, including the biodata of the patients, what you want, what corrections you want, what are the chief complaints, and special instructions, and so on. Okay. Now, how you take the 2-step impression with the PVS? We also have a hands-on for this. So let's view. This is the armamentarium which is required for the PVS, that is the polyvinyl silicone impression. First of all, obviously, you will seat the tray into the patient's mouth and you will check it, whether the tray fits properly into the upper and lower arches. Once the tray is done, you prepare with this PVS material, heavy body that has been taken and it's loaded into the tray, and then it's inserted into the patient's mouth. Setting time is approx 2 to 3 minutes. Once the setting has been done, you check it, you remove it. Now you apply the adhesive layer onto the surfaces of the teeth. Adhesive layer, and after applying surfaces of the teeth, you load the light body. And then again, light body is applied to the surfaces of the teeth. You load the tray, and the impression is ready. So this is how you take the 2-step impression. You take the impression with the PVS with the 2-step technique. Again, application of the putty, heavy body, the light body, and then capture the details. This is how you receive the fine impressions. Why we go for the PVS or putty impressions? Because they give you a very fine detailing and they have an increased dimensional stability. Okay. Now there's some sort of faulty impressions. The most common faults you find in the impressions are putty show through. Can you see? The putty can be seen. So this is the most common fault. Then you see the voids or the pores into the impression. Third most common, the material is not completely set, or you have removed it unset from the patient's mouth. Tray can be seen from the impression material. It means that the material is short. There is poor bond between the 2 types of the heavy body and light body putty materials. There is inadequate bonding with the tray. This is due to the excessive pressure you have applied while taking the brushes. Then most commonly, the last molars, they were neglected, the tray was short and the entire anatomy was not captured properly. And last, double printing and double relining. So here also you can find these impression materials. See, the occlusal surfaces have been not recorded properly. There is missing surfaces, there is missing cervical lines, distorted occlusal surfaces. So these impressions, they are not acceptable. Because obviously they are not giving you an adequate details. For the liner fabrication, we need very fine and detailed occlusion morphology of all the surfaces of the teeth. So any queries or questions up to now? Anyone? Yes, sir.
जैसे आपको पहले बताया कि आप एक लाइनर है उसके लिए बना तो हम ऐसा करते हैं कि लाइनर आपको जल्दी तो आ जाएगा उसको आपको 4 हफ्ते के बाद
No, that's a standard. That's a standard that each set of aligners have to be inserted for 2 weeks, that is 14 days, for 22 hours per day. Okay? And once you are done with 2 weeks, you have to move and you have to switch and replace it with another set of aligners. I will be discussing that in the upcoming slides. Any other queries? Yes, please.
As we know that compliance of the patient is very important in the last that is a major factor that they face other than the missing. Is there some other difference that we can help the patient in the achieving the compliance?
अच्छा, first of all, compliance के लिए patient counseling is really important. From the first day the patient arrives at your dental office, it's really important to counsel the patients and to tell them all the details in what's the duration of treatment, for how long you have to wear the aligners, what's the frequency of wearing the aligners, everything. And you have to counsel them. If they're not doing that, of course that will result in any sort of mishap or the malalignment or revert back of the treatment.
So that is a contraindication.
No, that's not exactly a contraindication, because you can easily judge the patient and you can convince the patient. So then you have to counsel their guardians and parents to keep a strict eye on that. Because see, in this case, external and internal motivation depends a lot. If the patient is internally motivated, वो खुद करना चाहता है कि मुझे करवाने अपने दांत, he is very aesthetically concerned, वो definitely कुछ भी करके he'll follow the instructions. But if he is externally motivated, ठीक है, parents का pressure है नहीं करवाना है, the child himself is not interested, तो फिर ये issues common ही आते हैं.
एक step ऐसा हो जाता है कि group हो जाता है, उससे next step पे जाना है किसी को
No, you have to conduct a team and we will give you the missed or misplaced aligners. You cannot just jump or skip any step.
उसकी cost क्या होगी?
वो our team will guide you accordingly.
तो आपको नंबर का टीच करना का कुछ हो गया
Exactly. ये सारी चीजें they are coming in the upcoming slides. How you monitor this? Any query? Yeah, exactly. We'll guide you accordingly कि आप पिछले step पे continue रहें. Meanwhile, we will fabricate the new set of aligners and we will send you. Exactly, we will, of course, because that's the patient's fault, no? That's a misplaced, and we have to charge it for the penalty. वरना the patient बार it's same. कि fixed ortho में आप एक दफा दो दफा लीवर देते हैं, वो continuously brackets तोड़ते जाएगा, dislodge करके लाएगा, you charge them. That's a penalty, so that they can become more accurate on the next time.
पीछे जाने की बजाय अगर उसका normal जैसे अपना fixed returning के लिए दे देते हैं,
No, that won't work.
तो वापस जाने का पैच की बजाय उधर ये तो स्टे करवा देते
No, it's better कि previous वाला आप लगा दें, and then sometimes you also ask for current scans. Exactly. ठीक है?